Good evening, hi, and welcome to the River City Forum. This is your host, Nabil Seyam, and tonight is not just a special night, but every night is a special night for all of us. And the reason I say that because I have what I'm gonna call a gift. You could call it a Christmas gift or holiday gift, but we want to offer you tonight a very, very special gift. How could you get your teeth cleaned for free? How can you get free dentals? Now, to visit the doctor, it costs you money just to get in, But this is the show, as always. We've done a lot of service to the community of Wichita and Sedgwick County, mainly through the River City Forum TV station with KCTU Channel 5. And tonight we're going to prove to you that the program that is called K-Mom is providing free dentistry to the community, to anybody actually in Kansas. And with me tonight is a very dear special guest, is Dr. Sara Meng. Good evening.
Good evening.
How are you?
Very good.
Welcome to have you here on the show. Dr. Sara Meng actually is a Kansas State University graduate, and she also attended the School of Medicine at the University of Nebraska as a dentist.
Yes.
To be a dentist, I know you went to school for 4 years, then you went to medical school as a dentist, to be a dentist for another 3 or 4 years?
4 years of dental school. They have a specific school for dentists because there's a lot of clinical training that goes on, and it goes on right at the school. They bring in patients in your second, third, and fourth years of dental school, and you see patients in the clinic at the dental school to learn your craft.
What made you want to be a dentist? Does it run in the family?
No, it doesn't. I'm actually the first dentist in my
family.
You
are?
But I just always really liked helping people. I liked the idea of a medical profession that allowed me to work with patients of all ages.
What is so challenging about being a dentist, not just an MD? I mean, what is the difference?
There's a difference. Mainly, you work with your hands a lot more. There's a craft to
A
dentistry.
lot of repetitive.
A lot of repetitive motion, but also a lot of artistry goes into it. There's a lot. You're doing. Basically, sometimes I describe it as you're doing work like you would putting a ship in a bottle. You're working in a very small space under wet conditions with materials that you need to keep dry.
Right.
So it's very challenging.
What makes a good dentist a good dentist? I know you are a new graduate, and now you have your own business in town in Wichita. But what makes a person visit this doctor but not that doctor?
And I think word of mouth is the biggest part of it. I think that if you are happy or your family members are happy with a certain dentist and their style of working with patients, that's the dentist you need to see. You can also find dentists by looking in the yellow pages. The Wichita District Dental Society is a good place to look for referrals. Now,
brushing. Sometimes people brush their teeth only in the morning, once before they go to bed, sometimes, 3-4 times a day. Is there a certain number how often we need to brush our teeth?
There is really no set number because everyone is different. Every individual has different needs in this world, but we usually recommend twice a day, and then as needed, whenever you have that not so fresh feeling in your mouth or you notice that you have some food stuck to the teeth.
So when you say twice a day, are we saying in the morning and at night?
Normally in the morning and at night, because while you're sleeping, bacteria have a chance to grow and reproduce because you're not swallowing or eating, which brushes the bacteria away from the teeth. So that's a good reason to brush in the morning. And then at night, it's very important because you've usually spent the whole day eating, drinking, doing things of that nature. So you want to make sure that you remove those things so that the bacteria doesn't have more food to grow on while you sleep.
When you said bacteria, is that the reason why we have sometimes in the morning a smelly mouth?
Yes. Basically, what you are noticing is bacteria in your mouth that has grown and produced waste products.
What about, is anything out of the stomach or just the mouth?
Some people do have reflux and things of that nature, and that's something very important to talk to your doctor about because it can damage not only your teeth and your mouth, but also your esophagus. So that's a very important thing to look into.
The issue of if somebody brushes his teeth or her teeth and then they rinse their mouth and all that, still we have a bad breath in the morning. So within that short period.
And part of that is that in America we don't focus on the tongue. The tongue is a very large large area of bacteria concentration. You have, people will have what they think is a furry tongue, and we do have papilla on our tongue that's a rough surface. It's an ideal place for bacteria to hide. So it's very important to do tongue hygiene also, not to just brush the teeth.
This is very important.
Yes, it is.
So when you brush your teeth, you also need to brush your
tongue. And people in America, it's just something that we've neglected. In Europe, it's actually much more common, and they've created mechanisms like tongue scrapers, and you can find those in your grocery stores and your Walmarts. But tongue scrapers are very beneficial because they remove quite a bit of the bacteria, and that's normally where your bad breath comes from.
What about the gums as well?
The gums as well, but the gums and the teeth, that's not usually where the smell comes from. Usually it is the bacteria concentrated on the tongue. So it's very important to take care of both.
What about, if you go to any grocery store, you find about 50, 60 different types of brushes. And some are expensive, some are cheap. Which one to pick?
What I recommend is a soft bristled brush because we don't want to do damage to the teeth or the gum tissue. But really, the best brush is the brush that you will use, as well as the brush that touches every surface of the tooth, because if the brush doesn't touch the surface of the tooth, it can't clean it. So it depends on the person using it, which is the best brush for them.
Sometimes we see brushes that they're tilted this way.
Yes.
For the back.
For the back. And that's usually to help people with dexterity problems, or if they have a certain need or something in their mouth that's tough to reach.
What about those expensive electronic ones, electrical?
Those can be very beneficial.
Are they?
If you use a regular toothbrush the same way and in the right manner, you can do the same job. But the electric toothbrushes are very helpful if you don't have the right technique, if you're trying not to brush too hard, because they can have sensors that let you know that you're brushing too hard. They also have timers on them that let you know how long you've been brushing, because it does take quite a bit of time, normally about 2 minutes, to do a very thorough, proper brushing. So any brush that you use has to work for you.
Again, if you would like to be a part of the show, call at 267-8855, 267-8855, and we're going to offer you free dental clinic if they call the show. We promise. Brushing. What is the best way of brushing the teeth? I've heard up and down, just up, then down, then rotations. I mean, there are so many different theories nowadays. And I know you have some tools here. So can you show us?
I do have a model. And brushing is something that we've all done our whole life, and you think that, well, I'm doing it right. Circles, side to side, things of that nature. One thing we discourage is to go this way, across the teeth, because this will cause abrasion of the teeth as well as the gum tissue, and you'll get what we call recession, where you lose gum tissue and it exposes the root of the tooth, and that's not a healthy situation. It wasn't until I went to dental school that I learned what we call the Bass technique, which is to take the toothbrush at a 45-degree angle and brush along the gum. You want to go all the way around the outside of each and every tooth. So all the way around the outside.